Medications that lower cholesterol. So forget all the natural stuff you can do, which is cutting saturated fat and eating more fiber. Those two, biggest bang for your buck. What are the medications and what order do you use them in to lower cholesterol? So the first and foremost, you would use a statin medication. They're cheap, they're generic, they're very well tolerated. They are super potent. Of all the things we have, they're probably one of the most potent. Now you can combine them with other things to get even more of an effect. The second one you would add is Zetia. Now a lot of times my patients, because they're cardiology patients, I would put them on Zetia and a statin together because they need a lot more lipid lowering than the average person who just is super healthy, never had a heart attack or stroke. So statins block cholesterol synthesis, Zetia blocks cholesterol absorption. It blocks cholesterol absorption in your intestines, and it is usually your own cholesterol that you made and are now trying to eliminate. Next, you would add something called a PCSK9 inhibitor. There are several of these. These allow your liver to recycle and eliminate LDL cholesterol faster or more often. There's LDL receptors in your liver. They go out and grab lipoproteins to eliminate them. It helps these receptors recycle faster rather than being degraded. Next, you would add something called bempedoic acid. Bempedoic acid works sort of like statins, but only in the liver. It does not block cholesterol synthesis anywhere else other than the liver. It sits a couple of steps ahead of statins in the cholesterol synthesis pathway. That would be added later on. It's a little bit weaker. It's not as strong as many of the other medications. With a statin, Zetia, and a PCSK9 inhibitor, you can get up to a 95% reduction in LDL cholesterol, which is fantastic because we could not do this just a few years ago.